This is the program that brings you all the important information you need to know about NAFDAC, the agency saddled with the responsibility of safeguarding our health by ensuring that the foods, drugs, cosmetics, and medical equipment made available to us are safe and wholesome. Welcome to NAFDAC and Your Health. My name is Tosin Adebayo. On this edition of the program, we touch on the subject of trans fat and the danger they pose to health, as well as NAFDAC's effort at eradicating trans fat from our foods in Nigeria.
Trans fats are fats or oils that have been hydrogenated to make the oil more stable. But making the oil more stable, becoming trans fatty acids, means that when a consumer eats a food or some foods with trans fat in them, the probability of that fat that has been translated into one that is more stable, the probability that it will also be deposited in our vessels in the body is higher. And trans fatty acids can cause all sorts of cardiovascular diseases because of continuous depositing of the oil or the fat along our vessels. Any oil that you see that is sleeping at room temperature, meaning it's becoming more semi-solid than what it's supposed to be, is dangerous for our health. But even if it is not sleeping, meaning it's not changing to semi-solid or soft pulp, it can still have trans fatty acids in them. And it is because of this tendency to want to make it much stable. But aside from the ones that are physically made more stable or chemically made more stable, there are trans fats in meats, especially red meat, that will cause the same type of effect in our body. That is one of the reasons why if one is cooking, whether it is chicken or red meat or whatever, first of all, red meat is better to eat less. And when you boil the red meat, you may need to let the water cool down so that you can scrape the fat out. So it's not like you cannot eat red meat. If you have to eat red meat, make sure that you're not taking a lot of fats from it, because many times they are trans fatty acids. So there fish, for example, has less fatty acids, and so it doesn't cause as much damage in our vessels as red meat or chicken. When one is preparing food, one should make sure that the fat part of it is removed as much as possible. Vegetable oils generally are less in trans fat, but vegetable oils can also be hydrogenated to have fatty acids. It's a chemical process that turns normal oil into fatty acids that are more stable. Olive oil is very low in trans fat. It's costly, but it's very low in trans fat. So olive oil is very good.
Recently, the agency, in collaboration with Network for Health Equity and Development, organized the Knowledge Sharing Forum in its bid to achieve a trans fat-free Nigeria.
Today, we are having the National Stakeholder Meeting on industrially produced trans fatty acids in Nigerian food supply as a prelude to buy-in of all stakeholders in the fats and oil and food containing fats and oil regulation, which is pending for gazetting in Nigeria. We brought the stakeholders together because they have to buy into the regulations, and when implementation comes into being, so that everybody will know the rules and expectation and requirements for them to be involved in their production, marketing, distribution, importing of fats and oil that has to do with industrially produced trans fatty acids. Trans fatty acids is a concern to WHO, generally because of public health impact from non-communicable diseases, and there is need to make measures in every country to keep the consumption to minima or to even eliminate, if possible, from the food chain. And what we are doing is in relation to that efforts to have a tool which we call fat and oil, food containing fats and oil regulation.
The forum tagged National Stakeholders Meeting on Reduction of Industrially Produced Trans Fatty Acids from Nigeria Food Supply was supported and attended by participants from WHO, Federal Competition and Consumer Protection Commission (FCCPC), Standard Organization of Nigeria (SON), Public Accountability and Participation, Federal Ministry of Justice, Federal Ministry of Health, Resolve to Save Lives, and indeed Network for Health Equity and Development (NHED). The DG was represented by the Director of Food Registration and Regulatory Affairs, Mrs. Juliana Abayomi, MNI. The DG, in a welcome address, expressed their hopes that all stakeholders will collaborate to chart an actionable pathway to attaining a trans-fat-free Nigeria.
In the last few months, the agency held a pre-stakeholders workshop with representatives of key associations to discuss around plans for reduction of ITFA. These stakeholders meetings are another opportunity offered to enable us chart a way forward on ITFA regulation in Nigeria. Intake of trans fatty acid is associated with increased risk of health attacks and death. To key into the global concern as adopted that with this forum and the discussions today, we will all partner and collaborate.
We're going to really celebrate when we have the TFA regulation eventually passed. The journey to eliminate the TFA in food supply started when Denmark was the first country to achieve that in 2003. Around 2015, some EU countries joined by limiting TFA. By 2018, we have US, Canada, and some other Latin American countries join. India has joined the league. So I think South Africa is the only African country that we have at the moment that has passed the regulation in 2011, I think. So Nigeria would be probably the second African country to achieve this stride. So we are really, really excited and looking forward to becoming the second African country to achieve this. Our work, RTSL, is to support government to ensure that proven, cost-effective, impactful policies are developed that would help to reduce cardiovascular morbidity and mortality. And in Nigeria, we've been doing that through the NAFDAC, in-country partner, GHAI, and their sub-grantees, and the Federal Minister of Health. So we'll continue to do that even after the passage of the regulation. We're going to continue to support government to ensure that at the end of the day, when the regulation is passed, it is fully implemented, because there's no point working so hard to have a regulation passed and we just dump it there and it's not fully implemented. So we are open to continue to collaborate with partners and also work with government to ensure that we achieve this success.
The journey towards regulation of industrially produced trans fatty acids has made substantial gains, and so this forum is organized by NAFDAC to review the propositions and processes of the regulation to ensure all relevant stakeholders are carried along in the process.
I wish to also thank NAFDAC, the convener of this event, even though they were saying they are supporting her. They are the conveners, and we are only supporting them to ensure that this event takes place. And that support, goes to everybody. Also, we should thank the Federal Ministry of Health, who have backed us all through this, development partners and others. We've been able to getting the revised regulations up to the point of gazetting. And I'm sure after this workshop, all of us fully mobilize with relevant departments and agencies of government and international organizations and the rest, that will be finalized in the shortest possible time. 2 is trying to amplify the issue of alternatives for PHOs, partially hydrogenated oils, which we'll be discussing later on. Because if we are saying remove trans fat, what are we going to use that is economically viable and effective in the commercial market? That NAFDAC is also discussing. Thirdly is actually implementation. Because if we have the oils and fat regulations and labeling gazetted and it's not implemented, I think we have just done 1/4 of the job. The key thing is implementation. So we should be start thinking about, as coalition partners living here, if the Ministry of Justice, as they have promised us, have the gazetted document out, how are we going to implement it and how soon? And then fifthly, is getting a strong coalition so that we don't stop here in our various roles, ensuring that the coalition moves on to create awareness for consumers and the general public about the dangers of trans fats, about how those ways of controlling trans fats in various foods and the rest, and then ensuring that the regulations are actually adhered to. I'm happy to hear that there is to hear from various goodwill messages that there's commitment from both NAFDAC, the various arms of government, other arms of ministries of government, and development partners, both national and international, and civil society organizations, that this activity will not just stop here, but will move forward. So we're looking forward to a committed, leaving this workshop, a committed coalition that has, 1, a gazetted regulations and labeling, out as soon as possible. 2, NAFDAC and all of us thinking of how do we now implement the document. And 3, how do we ensure full commitment from the various organs of government that the general public is aware of the dangers of this and ensure that that carries out. I'm sure we have, with this at the back of our mind, the workshop will actually deliver on its mandate. Thank you and God bless.
NAFDAC and your health will be back in a moment. Please stay tuned.
The MedSafety app is the latest reporting tool introduced by the National Agency for Food, Drug Administration and Control in November 2020 as part of the Innovative Medicines Initiative project. The app is made available to the public in collaboration with World Health Organization, Uppsala Monitoring Center, Medicines and Healthcare Products Regulatory Agency, UK, and National Agency for Food, Drugs and Administration and Control, NAFDAC. The MedSafety app allows users to track safety information of medicines, vaccines and other health products, report adverse drug reaction to a medicine or vaccine, and view data on suspected side effects. When you have received your COVID-19 vaccine, you can use the MedSafety app to report any adverse reaction or side effect you may feel. The app can be used by anybody, irrespective of whether you are a medical practitioner or not. You, your family, and friends, everyone can download and use the MedSafety app to report adverse drug reaction. Just search for MedSafety on Google Play Store for Android and App Store for iOS. When using the app for the first time, the user needs to select his or her region. In this case, Nigeria, and also choose the preferred language of choice. The user will then be taken to the login page where you create an account by providing your email and password or proceed as a guest. To create an account, you are required to provide the following details: reporter type, example, physician or pharmacist, as well as their name and email address, password with at least 9 characters with 1 uppercase letter and a number. Read the privacy statement and accept. Once you are logged in, the user is presented with a number of tabs, which includes news, products and watch lists. Under the Report tab, the user can report a new suspected adverse drug reaction ADR. On opening a new report, the user is prompted to input patient details, which include initials, sex, and date of birth. The user is then required to input details of the suspected medicine. These include suspected medicine name, other drug details such as strength, batch, dosage details. Multiple suspect drugs and concomitant drugs can be added at any time. The report can be saved and completed at a later time. A saved report can be found on pending reports and can be continued by clicking on the report and continuing from where the user stopped. Enter reaction details, reaction date and outcomes. Multiple suspects' reaction can also be added. Also, further details about the report can also be included, such as did the reaction cause prolonged hospitalization, disability, congenital anomaly, or birth defect, life-threatening results in deaths, and so on. Finally, you can also add details of any relevant medical history before submitting the report. The user receives a message on the app confirming submission and an acknowledgement in the mail for submission. Reports can be created and saved without internet connection and be sent whenever internet connection is available. The product tabs show all medicines in the NAFDAC list database. It's easier to navigate to a drug or vaccine of interest, and this data is obtained from the WHO Uppsala Monitoring Center. User can also add products of interest to their watch list to get the latest information on the drugs. All products added to the watch list can be viewed in the watch list tab. The News tab displays drug safety information by NAFDAC. This is usually up to date with drug safety information. Registered users can also edit their profile or change app settings. For more information on the app, please contact the National Pharmacovigilance Center (NPC) at NAFDAC headquarters, plot 2032, Olusegun Obasanjo Way, Wuse Zone 7, Abuja, or call 09290511110 or send email to medsafetyapp@nafdac.gov.ng or pharmacovigilance@nafdac.gov.ng.
Welcome back. If you are just joining in, you're watching NAFDAC and your health. Trans fat has been proven to be responsible for a number of diseases, especially cardiovascular diseases in Nigeria, and therefore it is in the front burner of NAFDAC food regulatory focus because the sources are widespread.
Trans fatty acid can be from animal sources and or also from industrially produced one. Whereas the animal sources are of concern. One of the big concerns, especially for today's reference, is industrially produced trans fatty acid. And these are trans fats that are generated in the process of food processing at the industrial level. And usually the primary source is PHO, what we call partially hydrogenated oil. And the issue of PHO usually comes into food processing during processing of things like converting a liquid vegetable oil to a solid form. The process of hydrogenation is where you introduce hydrogen into production of food, like we have in the production of margarine. But margarine, in this case, if fully hydrogenated, will not be a potential source. The issue is when this hydrogenation process is not complete and is partially if it's interrupted in the middle, that's why we call it partially hydrogenated oil. So these are PHO, and this PHO have a way of also getting further into secondary food processes like baked products, the production of biscuits and all that. Whereas there needs to be more to be done on testing of some of these products in Nigeria to ascertain their main sources. But from literature, we know that many supermarket products, fast food products that requires high fat and oil can be a source. And from the study that has been conducted in Nigeria, it's been identified that biscuits may be a potential source, especially wafers. And you know, a lot of children eat wafers, even some adults eat wafers.
The stakeholders meeting on reduction of industrially produced trans fatty acids from Nigeria food supply considered alternatives to what is currently being used by the food sector, and indeed concerns such as supply chain and costs, for which this recent meeting is called to deliberate upon.
Regulations are always made to explain areas where they were not explicitly stated in the parent law. So normally you get what you call stakeholders, even from the beginning, because you need experts in those areas you want to make regulations. From the agency, sometimes even outside the agency, before you begin to draft your regulations. If regulations are to be made in respect of drugs and drug products, so you see the experts, the pharmacists and scientists in that area, will come up with road draft of the intent of that regulations. Then it will now be fine-tuned by lawyers, although lawyers can be involved right from the beginning in order to guide, the other professionals in making the regulations. So the same thing applies even if it is food. So the food scientists or food technologists will start with the zero draft of that area that they want regulations to be made. And lawyers are incorporated when those things are, being drafted, when the provisions of the regulations are being drafted. So those regulations will now be passed to the Honorable Minister of Health in order for the appropriate department in that ministry or officials of the ministry to now make their own input as well into that regulations.
However, the agency has updated the regulations regarding fatty acids in Nigeria, awaiting gazette by the Federal Ministry of Justice.
We used to have fat and oil regulation 2005, but because of experience from other countries who have gone further to have their own ITFA control mechanisms, we've expanded the content essence, not just to be fats and oil, but to be fats and oil, and fats and food containing fat and oil. If you look at all our efforts in this regulation is to set out the principles of what and how oils that should be used in our food chain, whether you are manufacturing, you are supplying, you are distributing, all geared towards what? To reduce the industrially made trans fatty acids, which is very, very, very harmful to the body. And they are responsible for a lot of cardiovascular diseases as well as some other non-communicable diseases.
When the regulation is gazetted, Nigeria will be the second African nation to do so, thereby safeguarding the health of the nation from further health hazards caused by trans fat. That's it for today. Make it a date, same time, same station next week for a fresh edition. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded. Importing, producing, distributing, and selling fake drugs and cosmetics, adulterated food, and so on are criminal activities that destroy lives. Join the fight against these heinous crimes by reporting any suspicious activity in your area to NAFDAC. Let's join hands to safeguard the health of our nation. Until next week, stay safe.